Next. Great, thank you so much. The Menstrual Cup Coalition was founded kind of informally in about 2015, and at that point it was including people like the indomitable Janie Hampton, who I hope might be joining us online, but it was a collection of us who really wanted to understand what was going on within menstrual health more wholly, but also specifically with menstrual cups, to understand what was the evidence showing us, where were people doing programs, what was working, and trying to ensure that that knowledge was being shared so that we could all try and improve our work through that. Obviously, quite a lot of things have changed since then. The Menstrual Cup Coalition is now formally registered as an organization, and having had a bit of a shift, and obviously there were things like COVID, we're so thrilled to be back and really speaking to that effort to try and share knowledge and understand what works and try and improve all of our programs through that sharing. I think it's really worth reflecting that in the 10 years that I've been working in menstrual health, there has been such a growth in interest and understanding in the area. We now see period poverty being discussed in the media, in policy, in governments all over the world. But I think there is still quite a lot of understanding to be grown. And I think that while there has been discussions around reusable products and some of the other elements that periods can impact, particularly around schooling, there is still quite a lack of understanding, to be honest, around menstrual cups. But we know that more and more they're being used. And I think what is extraordinary is that whereas previously it was a lot of anecdotal evidence, it was a lot of a sense of this has worked for me, maybe it'll work for someone else. As a proud cup user myself for the last 10 years, that was certainly my hunch. We now have some of the data. And frankly, we really, really need it, because the only way that we are going to be able to raise funds, improve policy, improve understanding is with robust evidence and ensuring that that's being used. We know that menstrual cups are by far the most green menstrual product there is. They have about 1% of the carbon impact of anything else. We know that for people that can afford to buy products, they are by far the cheapest. But we also really are starting to see so many other benefits. And that's what we're going to be looking at today is what can we see and how do we capture it, both at the most robust university level through to small civil society organizations. Menstrual cups are not a silver bullet, but they are an extremely good option. And we know that they can tangibly impact the lives of women and girls. I was lucky enough this year to be at the Women Deliver conference in Rwanda in July. And there was so much more discussion around menstrual health than there had been at previous events like that. But I would say that menstrual cups were still kind of on the edges. And one of the best and most powerful moments I felt for me was when an activist from Cameroon stood up at some point and said, look, this is fantastic that you're taking such interest in periods, but can you please stop trying to tell me to sew my own sanitary towel? And I think we do have to listen and learn as to what is being done, what is actually wanted, what works for users. Menstrual cups have never, ever had an advertising campaign. Big corporations don't want people to use reusables. We know that any high quality cup should be reused for 10 years. They want products that people buy every month, understandably. That's good for their business. But is it good for the users themselves? These are something that have spread purely by word of mouth. So to carry on that of spreading word of mouth, I'm going to move on to our first speaker. Just as a little bit of housekeeping, as I said, we're going to do 5 presentations today. And I'm going to ask that you keep your questions, and then we're going to do a Q&A together at the end, just because I want to ensure that there is enough time for everyone to speak to their presentations. However, if you have questions during, please pop them in the chat box. I know that sometimes you have something and you don't want to forget it. Pop it in there. I've asked that the speakers try and look at it when they stop speaking and try and answer there as well, so that other people can also perhaps see those. We will be coming at the end. As I say, we'll also be talking a little bit about other things that we want to build out of this and what's useful for you. So with no further ado, can I introduce Dr. Garazi Zuleika, who is a postdoctoral fellow at the Liverpool School of Tropical Hygiene and has been working on a large-scale menstrual cup pilot in Kisumu in Western Kenya, and is going to speak to us today around some of the incredible health benefits that they've been seeing in that study. Thank you, and over to you, Garazi.
Thank you so much. So hi, I'm Garazi Zuleika, and I'm here to talk about menstrual cups' impact on girls' reproductive health. So the findings that I'm presenting today come from the Cups or Cash for Girls trial in Western Kenya and the nested sub-study Cups and Community Health. Next. So a bit of background on the study. We ran a large 4-arm cluster randomized control trial in Siaya County, Western Kenya, that was trying to assess whether menstrual cups or conditional cash transfers could improve adolescent girls' health and schooling. And so we enrolled over 4,000 girls across nearly 100 schools in early 2017 and followed them until they finished school, with the last ones being followed until about June 2021. And the 4 arms were, the first arm being a menstrual cup arm. So girls received 1 moon cup with training on safe use and cleaning of their cup. A second arm received conditional cash transfers, which were termly and based on prior terms attendance. A third arm received a combined intervention. So they got both the menstrual cup and the conditional cash transfers. And then we had a 4th control arm where girls maintained their usual menstrual hygiene practices that they had prior to the study. And to note, girls had to be menstruating at enrollment to be eligible to participate. So next. So our trial wanted to see whether these interventions would ultimately impact school dropout, HIV, and HSV2. And so we hypothesized that some of these pathways we talk about often, we hypothesized that these interventions could have some intermediate outcomes of improved mobility and comfort for girls who are using cups with fewer required changes in emptying, and also incentivized schooling and potentially some improved economic standing through the cash transfers. And through these, we were hoping that they would then we would see a reduction in risky sexual behaviors, such as reliance on transactional sex. So some of the sex for pads conversations we've had, a reduction in other risky behaviors like condomless sex, age discrepant sex, and reduced number of sex partners, and some improvements in schooling, namely decreased absenteeism, which has been difficult to capture, and some improved concentration by not having to worry about things like leaking and odor during school. And lastly, we wanted to see if there was potentially a biologic pathway between the menstrual cup, use of more hygienic materials, improvements in the vaginal microbiome, and then reductions in STIs. And so I'll discuss that in a second, but to say that we thought ultimately, while adolescent pregnancy is not one of our main outcomes, adolescent pregnancy in our cohort is very, very tied to school dropout. And so what we see is girls who fall pregnant, and there's high rates of teen pregnancy in this cohort, also often drop out of school and are often unable to return to school for a multitude of reasons. So next. So for this last biologic pathway, we ran a sub-study in 6 schools, which was trying to evaluate the effect of menstrual cups on the vaginal bacteria directly, and to see whether that would then decrease bacterial vaginosis and STIs. Next. And so what did we find? Can menstrual cups be this multi-purpose tool that not only improves girls' experiences during their menstruation with improved dignity, comfort, and but also be this tool to improve their sexual and reproductive health and potentially schooling? Next. And what we found was that cups did actually improve the vaginal microbiome. We saw a 37% increased odds of a healthy vaginal microbiome composition. So that is to say, girls using menstrual cups had more good bacteria in their vagina and lower rates of dysbiotic or different bacteria that you don't generally want to see. We also saw a lower rate of bacterial vaginosis and sexually transmitted infections. So we had 24% lower rate of bacterial vaginosis in menstrual cup girls compared to control. And we saw a 23% reduction in incidence of a composite of STIs, which were chlamydia, gonorrhea, and trichomoniasis. And then in the full trial across all 4,000 girls, we also saw a 33% lower incidence of HSV2, which was quite exciting. So we saw these big reductions in STIs, which were really encouraging. And while we didn't see a direct impact on HIV, we note that a lot of these infections are synergistic. And so, for example, if a girl contracts HSV2, her risk of contracting HIV goes up 5-fold if it's a first infection, and 3-fold if it's a recurrent infection. And so we do think that over time, if we were able to get a handle on a lot of these STIs and BV and reduce their transmission, we would potentially see an impact down the line on HIV as well. In our cohort, which was quite young, we had a very low incidence of HIV, which is also great. It was only 1.25%, so we were underpowered to see direct effects on HIV. But we're still encouraged by what we do see. And unfortunately, we did not see any change in school dropout, noting that school dropout is also driven by these external factors like school fees that are differential across schools or adolescent pregnancy, like I mentioned before. Next. And so people always ask, did girls enjoy using the cups? Did they actually use the cups in the trial? And so I've put this here just to note that in both cup receiving arms, the cup only arm and the combined arm, about 80% of girls, both at the mid-study and end of study follow-ups, reported using their cup at their last menstrual period. And they also voiced in focus groups positive experiences around comfort. So one girl said, if you had the Moon Cup, you are going to school, education is just normal, you are just normal, and you are just free. It is very difficult for someone to know that you are undergoing your monthly periods. You are confident, you are laughing, meaning you are free. So emphasizing that they're discreet. When using your Moon Cup, you are so comfortable, even if you are in class, you are not afraid that it will leak, unlike pads. So you concentrate in class and you are not worried. So emphasizing some of these the decreased stress around leakage and improved concentration in school. Some noted that it decreased financial burden. So the menstrual cup is a stress reliever. You are not worried about where to get money to buy pads. You know very well that when the period comes, you have something to use. And some girls even voiced improvements for the environment. So I prefer Moon Cups because sometimes you lack pads, and secondly, pads, they destroy the environment. They are not good for the environment. You don't know where they are taken. At least for Moon Cup, you are sure they will pour out in the toilet and rinse. Next. So what does this all mean? So in sum, what our study shows is that in places that have poor menstrual hygiene management and inadequate materials, this biological pathway that we were testing it proved it in a way. So menstrual cups do improve the vaginal microbiome, and through that they do decrease risk of bacterial vaginosis and STIs. And so menstrual cups appear to be an efficacious tool that could impact the Sustainable Development Goals 3 and 5 on health and equity. And so that's encouraging for lifting the agenda around menstrual cups and showing that they are something more than just a menstrual product that girls can use. They can really improve girls' reproductive health. And unfortunately, we did not see changes in the second pathway of decreased schooling problems or third pathway around decreased behavioral risks. And so a bit more work needs to be done there. But not to say that it shouldn't be done. So next. I've posted our trial papers here. So the top article has all the details from our main trial, and the bottom article from our sub-study for more details if you're interested. But and if you have any questions, post them in the chat or we can discuss them at the end. So thank you. That's all for me.
Great. Thank you so much, Garazi. And we'll try and pop the links for these studies just in the chat box as well so that people can access them. As I say, I think when I talk about things kind of having evolved in the last few years, to have a study like this that is showing not just that they're comfortable or not just people want them, but that they can actually improve health is, from my perspective, just huge and so exciting, and really highlights, I hope, to any health colleagues online why this is something that is absolutely necessary and critical to SRHR. So next, I'm going to be handing over to Jen Rubley, who I've had the honor of knowing for quite a long time and has very much been involved in the coalition for a while, and has really been at the forefront of understanding how do we measure these things. She's the head of data and M&E monitoring and evaluation at FEM International, and has done a huge amount of work on looking at indicators and thinking what measurements, when you've got Dr. Garazi's huge university level studies, but through down to small civil society organizations. So with no further ado, I'll pass over to Jen. Thank you.
Thanks so much, Alethea. I'm Jen. I've been working in menstrual health, more looking at the NGO sector for 10 years. And in this presentation, we're going to sort of move from this incredible, beautiful research work to like the nitty gritty of, doing it on the ground in smaller organizations that don't have that sort of same funding. Next, please. So pretty much measurement matters. I think we all know this. Data matters because at the end of the day, if you're not measured, you don't count, you don't matter, you're not included. And working in an already overlooked sector, we know this very well and we experience it firsthand all the time. I mean, until a few years ago, we didn't have a single validated tool. Menstrual health isn't in the SDGs. We continue to measure school attendance, even knowing it's not a good indicator and doesn't show any outcomes. And whilst we now have definitions for menstrual health and hygiene and menstrual health, we still don't really have good indicators to go along with that. So as implementers, it's so important to know whether or not programs actually, are working well, are working how we expect them to, achieving the results we expect, and understanding if not, why not, so we can adapt. And then we also need to be able to demonstrate this to key stakeholders, including like local leaders, governments, funders, etc. And as those doing CUPs, we know there are always extra barriers and landmines around those as well. They're an absolutely transformative tool. Preaching to the choir, I know, but we're consistently hearing excuses about populations or settings where CUPs won't work, and as opposed to letting people decide for themselves. And so it's super important to have data to back it up, to show that CUPs really are great across populations and contexts, and to actually demonstrate that. Next slide, please. The menstrual sector, more than anyone else, I feel, actually does understand the power of measurement, which is so cool. Love all of you for that. And the good news is there are now some tools that exist. Yay! And links are going to be shared as well to these, so don't worry. The first one is the integrated model of menstrual experience, which we developed as a theoretical model, and it basically shows how programs can be expected to lead to specific changes. So it's super useful for theories of change for programming and planning, evaluation, that sort of thing. The Menstrual Practice Needs Scale, MPNS, is the first validated tool. Yay! So it evaluates practices based on needs. For example, asking if somebody was able to change their product as much as they wanted, as opposed to how many times they changed their product, which is a really excellent perspective because all periods, needs, contexts are different. And so it evaluates on that as opposed to a one-size-fits-all definition. However, it is 36 questions, which even for a research project is very long. For our research project, we chopped it up, we had to. There is a short form of 18 questions, so still a bit long, but that's just been validated. And there's a rapid form of 9 questions coming, which is much more accessible for smaller NGOs and sometimes even research projects. There's been a big push to include menstrual questions on national data collection forms like DHS or PMA. So I think last year, the priority list of indicators came out with questions that can be included on these national data collection forms. They're not validated, but they are short and sweet, which really useful. They also feed into large-scale data sets and are comparable, which is really useful as well. You can look and see if your population aligns or if your project has resulted in significant changes from the population. And lastly, there's the Menstrual Practices Questionnaire, which it's also validated. It does pretty much exactly what it says it does. Both it and the MPNS look at domains like changing your product, transporting, washing, storing, drying. So they're good for both disposable and reusable products and applicable across contexts, which is really useful as well. Next slide, please. And now, like, we all know that the practice of data collection is night and day from, you know, this beautiful model that you might have. And this is what we're going to get into a bit, and designing for the field. First thing is, like, why are you doing it in the first place? What's the goal of your data collection, right? And so this goes a bit back to the slide on, you know, why measurement matters, obligations to funders and donors, governments, but there's also an obligation to program participants and to yourself as an organization. Like, sometimes you just need that pat on the back. So what you are doing in terms of MEL, the data you're collecting, how you're doing that, it's very much dictated by resources and needs. It's an expertise in and of itself, and having some training on it is not the same as having the expertise to design a valid and robust data collection tool, analyze that data. And most CSOs, small organizations, just don't have the salary for an MEL person. It's often the program manager or someone adding it onto their already full portfolio, right? Which gets us nicely into money, not just for salary for somebody, but to actually do the data collection, to track down people, print questionnaires or purchase tablets, offer chai and bites, transport, all of that stuff, which then becomes very dictated by context and the realities of tracking people down, getting them to sit down for a focus group or questionnaire, the logistics and ritual of it all. It's different everywhere, and it's really key to know and understand that. So in thinking about context, it's also important to understand things you can't ask about or need to ask in a certain way. For example, in developing the Tanzania and Kenya tool, obviously we wanted to ask about tribe, and our Kenya team said, nope, just don't. Whilst in Tanzania, it was like, yeah, not a problem. Like, why is this even coming up? Which is why it's so important that these tools be designed with the entire field team, not just in isolation or with management. There's just this invaluable insight that comes from everyone who's actually doing the work on the ground, and their voices and inputs are just as key. And then obviously, being the Menstrual Cup Coalition, again, the cups of it all is very key. We know that they're amazing and transformative, but we also know that, you know, programming is fraught with potential landmines. Uptake is often slow, lots of barriers and challenges. And the only way that we learn from what we're doing is through MEL, understanding what worked, what didn't, why, how we do better next time, and then passing that on to other organizations doing cup projects, because we've also seen how, like, one bad cup project can just ruin it in a particular context for years, and getting back to where you were in terms of cups is a year-long process. There's continuous pressure for cup practitioner to continue proving that menstrual cups are a valid and safe option, and demonstrate that we really do know how to do this well. Next slide, please. So for our work in East Africa, we actually developed one of the first program-based MEL tools for menstrual health, including cups. It was cool because at that time, like, the menstrual sector was so small, Africa globally, and it was through the very first Cup Coalition meeting, actually, that we started working on this with other organizations, with researchers, with businesses, on developing like a shared MEL tool, which I was super excited about. And even though, like, now all of ours look different, we all benefited massively from, like, being able to work together like this. And we often ask the questions differently, but we're asking a lot of the same things at the end of the day. So for example, for sociodemographic information, I chose to use the PPI, the Probability of Poverty Index, because it's been validated in each country. It's really widely used and therefore offers comparable sociodemographic data. It has a free website where you can go see national data and compare. So there's, like, no additional work for you to do, just use that. From the beginning, we used participation as an indicator, not attendance, because it's a much better indicator, and attendance is just fraught with issues. Participation in sort of daily activities is a better measure of overall well-being and impact. It's also more inclusive. It captures school, work, social activities, income generation activities, religious activities. It's also really gratifying that it really aligns nicely with the model, the integrated model of menstrual experience, which came out later, as well as the definition for menstrual health, which came out after that. Obviously, the version we use today has evolved. It's gotten better. We'd like to think it's gotten better. We workshopped and tested it, with the whole team. We tested it with our program participants and got their feedback, which taught us, what was working, what wasn't. We changed what we needed to. We learned over the years, obviously, and we took things that other people were using or had developed as well where possible, so that we don't have to, reinvent the wheel, so to speak, and exploring other things that have come up. So next slide, please. Through the Cup Coalition, I was connected to an organization in Burkina Faso who was wanting to begin cup programming. We got funding to do a pilot with just over 1,200 women with a community-based peer-to-peer model that was super cool and quite effective. Francophone Africa is largely overlooked in menstrual health overall, never mind cups. So evaluating this project properly was even more important, especially the Burkina context of being very Muslim, which many people like to use as an excuse to not do cups. Also high prevalence of FGM, which can be a major barrier, especially depending on the type that is practiced. So we took the FEM tool, we adapted it, we shortened it. It made me cry a little bit. There's always a trade-off between how much data you can collect and the realities of data collection. Translated it, which was a whole thing again. And the feedback we got on the first round was that it was still too long. And so I cried a little again. And sat down with the program team. So we went through the whole questionnaire, explained, they explained why certain questions should be gone. I explained why I wanted them. Some stayed, some went. But the important part of this was that the whole team understood decisions that had been made and why. And for the questions that were kept in, they could better explain then to participants why we were asking those things, which ultimately leads to better data collection. Yes, next slide, please. Which sort of brings us to the end of this presentation. So thanks so much for listening. If anybody has any questions or comments, please ask me or reach out to me. I've been working in this and consulting around this for quite some time, so happy to discuss wherever. Yeah, thanks.
Thank you so much, Jen. And great to see, the kind of adaptations in different contexts and lots of small things highlighted there. I think one of the things I really want to highlight today is that I know that cups are new to a lot of people and they feel like an innovation and they feel quite daunting, but to reassure that there is loads of information and a lot of work that's been done on this already. And that's really the goal of this, is to try and share. And crucially, that means understanding what hasn't worked as well as what has, and so how we can adapt. And I think the focus there around Mel being on expertise, the need for funding, the need for context, it's also being a chance for it to give yourself a pat on the back because you get to actually see what's working, is really, really nice as a way of framing it. Lots of other things to dig into, but for now, I'm seeing that people are posting questions and stuff in the chat. Please keep using that, and if you have things for Jen, post them there. We will have a chance for Q&A at the end as well. I'm hoping now to hand over to Kofi, who is joining us from Ghana. Kofi Nyanteng is the Monitoring, Evaluation and Learning Specialist for Could You? Kofi, are you ready to go?
Yes. Yes.
Great.
Good evening, everyone.
I'll pass over. Great.
All right. So thanks, Alethea, and good morning to everyone. My bandwidth issues wouldn't allow me to show my video till I finish. So I'm asking that I can just put off my video whilst I do the presentation. Right. So Could You? We have been working within the menstrual hygiene space for quite a period now, and we've done we've done more than 100,000 girls with the menstrual cups across the globe. But my presentation today is going to focus on a pilot we did in rural Ghana. Just to begin with, last year there was a study that was funded. Please, next slide, please. There was a study that was funded by Plan International that showed that 83% of girls in a district in Ghana's poorest region were involved in some transactional sex and were also recording some higher rates of teenage pregnancy. So what we did was to intervene with 2,000 menstrual cups And when we intervened, we have had some very good acceptability rate that is more than 90%, which we attribute to our innovative strategies as well as collecting timely, reliable, and verifiable data. Next slide, please. So for timely data, what I mean is that we collect frequent data that ensures that we are able to take decisions in real time. And also we report data that is very current. So our data is timely enough for our program decision at all levels. How are we doing that? At Kuji, we have a policy that whoever we work with, no baseline data, no menstrual cup distribution. And this is something we do because we know that data drives our program success. And it is a policy that is stated clearly in our MOUs with our partners. And we also have our cup track. We have designed a cup track, which will be shown in the next slide. Cup track, which monitors the cup usage, and that provides real-time feedback from the cup users. And we make sure that at least 70% of girls that we give cups at every community or in any intervention are visited, and then we capture how they are using the cup before we do any final evaluation. And we also have cup stories for qualitative data that I handle myself everywhere we do intervention. We ensure that we visit to get some qualitative data to support the quantitative data that we gather. But more importantly, M&E, data research, whatever, we need a lot of funding. So we budget 50 cents per data collected per beneficiary. And that is quite, I would say that it isn't enough, because considering the research, considering the activities that go in, it requires some resources to ensure that we are able to get our timely data. Next slide, please. So this is the cup track. The cup track has the names of the beneficiaries, the day that they received the cup, and also month one, whether the girl received the cup, whether the cup received was used during the first month, and then it has the days, how many days were used during the menstrual cycle. So we ensure that by second month, we have to visit at least 60% of girls that receive the menstrual cup throughout to the 5th month. So, and all this requires some funding. So what we do is that we provide some resources for our partners and also make some available for us to ensure that we are able to monitor the usage of the cups, to ensure that we are able to provide some advice. If there are any learnings that we get, we also keep that too on record. So the next slide, please. So we ensure that our data are reliable and verifiable at all levels. I think I've made mention of we providing 50 cents for every cup donated, but then beyond that, we also provide resources in terms of tablets, making funding available for enumerators, for their accommodation, for their feeding, for logistics, also providing them with airtime, as well as investing in building their capacity. For every partner that we work with, we run you through our M&A system, ensuring that you really understand so that you can kick off and get us the right data that we need. And that's why we are very much particular with our no baseline, no cap intervention policy. That's, in fact, when we don't have baseline, it means that we don't know what is going to happen, and we don't know the problem we are going to solve as well. So the point number 2 is that we have also designed an integrated data management system which captures every details of our beneficiaries, including their GPS location, their images, videos, making sure that we're able to follow up and verify and validate the data we have less stressfully. And then there are some physical verification of data. When the data comes to us, we ensure that we do some random field visits and then have some callback. And all these require resources for us to be able to get this data verified to ensure that we are able to come out with data that is more reliable, that is complete, and that can be accepted. I think I've made mention of the building capacity of our partners to get reliable data. So let's move to the next slide. Next slide. So basically, these are the two key areas that we look at. Number one, we ensure that we are getting timely data. And then two, we are getting reliable data that can be verified. And all these I've said required resources, required time, require the human experts to be able to do quality jobs. So for Kudu, no baseline data, no intervention. And we also make sure that our CAP track is well utilized to ensure that we are able to get the feedback that we need in real time to ensure that we get the right results that we need. So this comes to an end to my presentation. You can send your questions and I'll be willing to answer them for you. Thank you so much.
Great. Thank you so much, Kofi. And it's great to get such a kind of clear, practical examples of the sort of ways that these things are being tracked in different contexts, this one in rural Ghana. I think it's also really the statistic at the beginning, around 83% of girls in the region where you're working engaging in risky sexual behaviors in order to access menstrual products, really frames some of the links that menstrual products have to sexual and reproductive health more broadly. And I think reinforcing Jen's point around the need for funding, the need for expertise, both the quantitative and the qualitative. I think that was really interesting to highlight the quantitative with the cup track, but also the qualitative with stories being captured. So thank you so much for that, Kofi. And again, please keep asking questions in the chat. For now, I'm actually going to be handing over to Ajwang Wandai, who is based in Kenya and is going to speak to us about a program that she's been involved with in Kakamega, where the Menstrual Cup Coalition provided some technical support to a small community-based organization. I think we're going to start this presentation with a video and then hand over to Ajwang. So hopefully the video, we check the sound, hopefully this works. Thanks.
My name is Kong Deborah Halima. I am 14 years old. Chakuti nimeona pads inajaa haraka na tena kama una pesa ni shida.
My name is Anyuri Timhai. Kama sikuwa na pads nilikuwa nakaa nyumbani kwa sababu ningekuja shuleni kama sina damu ingepita kwa miguu alafu ndangu anze kunicheka.
Beverly Wangila Singh. I'm a teacher here in Muleche Primary School. The pads were expensive. You find you are experiencing your menstruation and you don't have money. So you are forced to use rags or even the tissue, which is very risky. You are unable even to visit friends. You cannot go partying. You cannot go out because of that. You fear.
Mara ya kwanza nilianza kutumikia mattress. Nilikuwa nakata mattress 4 pieces. Nachukua kiraka, naiekelea, naifunga mattress vizuri. Ani in case hiyo uchafu wa mattress isiniende huku chini.
Sasa venye hii ilikuja, hata sikosingi kuja shule na kuja, hata sikungi absent. Na kujanga tu hata nikienda menstruation.
Cups kwa sababu pads zinaisha haraka. Alafu pads huwezi rudia mara mbili. Ukimalizia ni lazima utope.
For my girls, they're also having problems here and there. Like for example, when I'm in school, I'll find a girl come to me, teacher, I'm having my menses, I don't have anything to use. So I was forced sometimes to use my own money to buy for them pads. But now that you came with this support of the cups, I can say you have really helped us. What they normally do is just to wake up in the morning, carry their cups to school when they know it is their day.
I'm Trufena Andati from Moleche Primary. I used to use pads, the normal pads, but since the time I started using the menstrual cup, I've cut on those expenses. When I use it, I'm very free. No more checkings if I've stained my clothes or not.
Nimefurahi na nimefurahi kabisa kwa sababu natumikia karibu 3 hours, 4 hours ama karibu nikieka saa moja mpaka saa moja, najua tu niko sawa na niko safe, naweza kukimbia, naweza kutembea, naweza ruka, naweza cheza na niko safe.
I'm very proud to continue issuing out the Menstrual Cup to our mothers, giving them confidence, can walk anywhere while having the cup.
They are now going to school regularly. They have now covered a positive attitude towards school.
The cups are really, really good because the girls can sit in class comfortably and the women in our community can walk comfortably. The movement has increased for them to go to their farms, work on their farms, take their crops to the market. So this has really improved our social economic aspect.
Great, thank you so much. And I hope the sound and everything worked as well for me, for everyone else. I'm now handing over to Ajwang, as I said, to talk through some of the impact that was obviously captured and some of the other learnings and challenges. Ajwang, over to you.
Yeah, thank you, Alithia. So hi, everyone. My name is Ajwang Wandai. And just going off from this fantastic video, from a statistical perspective, although we're still finalizing on the final figures as we just finalized the project at the end of October, the numbers suggest that there's currently an 85% uptake, which indicates that this project has been hugely successful. And what we really want to highlight today are just some of the challenges that we faced, as it's useful for us excuse me, to get to reflect and learn on this. So beginning with the technical challenges, we had a lot of discussions around virginity, especially with head teachers and teachers, where these people thought that the cup would encourage girls to have and want to have sex. We had a lot of queries around just health and the female reproductive system. So we had one girl who'd received a cup, but when she took it home, her sister told her that she shouldn't use it because it could cause cancer. We had a lot of queries around, once the cup is inserted, where does it sit, or which hole is it supposed to be inserted into? And so we found that ensuring that anyone who's involved in this program, from the trainers to the teachers in the schools to just the overall program team, that everyone should have gone through the FAQs and just general relevant questions, just to familiarize themselves and make sure that they're comfortable, such that whatever sort of query that they were to receive, they'd be able to answer these questions in a very comfortable manner. Next slide, please. So moving to the programmatic challenges, with the distribution, one of the biggest issues we faced initially was that there was so much enthusiasm built, partly because the trainers had become very happy cup users, and this meant that their focus was really around the distribution numbers than ensuring that we were clearly gathering the right data from the beginning. So once they started using the cups themselves, they saw that this was a product that could actually really benefit the community. And so they started speaking to the women around, and this created a lot of excitement and enthusiasm. So we therefore had to go back and reset expectations and just make it clear that even though 60 people turn up for a distribution and training session, that it's not practical and they would not be able to gather the right data. And this would ultimately affect the follow-up sessions and the quality of the baseline data, which would not be accurately captured or measured in this manner. Next slide, please. So with the follow-ups for the women, we found that with the difficult economic times, women were spending more time looking for small jobs to get money. They were working on people's farms, especially during the rainy season. They were going to cut firewood in the forest because the community bordered the Kakamega forest and going to the market to sell their produce. So because the community was a rural agricultural population, once the women received their cups, there was no incentive really for them to come back and share their experiences with us. And so the trainers were then forced to look for different ways to follow up, and they did this through phone calls. But at the end of last year, there was a new SIM card registration in Kenya, which meant that many of the phone calls which had been given to the women were disconnected, and hence some of the women were not reachable for future follow-ups, which then presented a big challenge. So these may seem like some small factors or excuses, but these were just the day-to-day circumstances that affected the women. and put a spanner in the works for us to think about how we can ensure that we reach as many women as possible. So with the follow-ups of schoolgirls, in one school where we had done a distribution, we went back for the follow-up after 3 months, and only about 20% of the girls had started using the cup. We then returned for the second follow-up within 6 months, and the uptake had risen to about 90%. So this showed us that with adolescent girls, the follow-up sessions are absolutely critical because they're nervous at the beginning and they need the chat during the follow-up sessions. And because they're a captured population, we could do the follow-up and clearly go back in and track again. So the uptake was also slow for the girls at the beginning because some of them were receiving pads from school. So even if they were not using the cups, they still had the option to use the pads. Whereas with the women, if they didn't have the cups, then they had to buy the pads using their own money. So they were able to cut costs in this area. Next slide, please. So the key adaptations and learnings, with the key adaptations and learnings. So we wanted to strengthen and build the capacity of the trainers. With the head trainer, he had good connections with the Ministry of Health, with the community and the head teachers of the schools. And the other trainers, we had a church leader, we had a teacher and a nurse. So this dynamic made it easier for us to introduce the cup as they were trusted individuals within the community. And so we focused on how we can build our support from an MEL perspective and how we can work collaboratively with these tools, with this team to track distribution and capture the data accurately and ensure that the tools that we were using met them where they were in order to produce very effective and quality data. So we did this by having lots of sessions individually and in teams on how we can capture the most effective data and information from these distributions, the follow-ups, and how we can receive that information on our end remotely for the most part. So those are just some of the challenges and learnings that we faced from this project. Thank you.
Great, thank you so much, Ajwang. And I think it's really helpful to think when you're, you have that video and some of those direct results, and then also reflecting on the challenges and the things that worked. And I think in particular, one of the things is really about meeting the communities. We've all discussed the kind of context that's needed to engage and understanding the pressures that's going on, certainly with some of the women who are then trying to work in the fields and things. That follow up is really challenging, and trying to ensure that you're getting that data, but in a way that isn't burdensome to the people that you're trying to work with. Okay, thank you so much. And it's great to see there's various questions in the chat box. As I say, we will have a bit of time for Q&A at the end, but please do keep talking to each other there as well. Make the most of that, and kind of trying to feed through queries, and I'll try and group them at the end for a bit of the Q&A. So we have our last sort of full presentation, this time from Ira Guha, who is based in India, and although I think might be in the UK at the moment, but has been working in India on ASAN, and is going to talk to us about some of their results there, and again, kind of really learning about some of the key aspects for a successful community intervention and how you capture that. So Ira, over to you.
Thank you so much. Thanks, everyone. It's great to be here. And also, I have learned so much already from the presentations today. So there's some wonderful work happening. So my name is Ira. I'm the founder of ASAN. Just a little bit about ASAN. We are a social enterprise with a mission to eradicate period poverty. We're based both in the UK and India. We designed and patented our own menstrual cup with a focus on being extremely easy to insert and remove. And the way that we work is with a buy one, donate one model. So we sell the ASAN cup globally, and for every one we sell, we donate one for free. And we also operate a lot of subsidized social impact partnerships, one of which I'll talk to you about today. So the next slide. So today I'm going to be talking about ASAN Cup adoption in Kanakapura, which is a district of Karnataka in South India, where we've been working for just over 3 years and we now have 15,000 women and girls across 60 villages using the ASAN Cup. This project was done in partnership with a local public health NGO, the Beleku Trust, who already has worked in this region for 3 decades. And I think when I tease out some of the insights from this program, one of the main things to take away is just, really having the right partner who enjoys very high levels of trust. Next slide, please. So just to understand a bit about the community we are working in Kanakapura, in terms of, this is a rural agricultural community. In terms of product usage at the moment, it's roughly split between homemade cloth rags and disposable sanitary pads. And in terms of the trends, we really see mothers and older women using cloth rags, and whatever sort of disposable income there is in the family usually goes towards spending on disposable pads for the younger girls or women going to college. And then in terms of disposal of pads, we found that 70% burn the pads and 30% throw them away. And I think what's really important to realize in terms of burning pads, it's not that they have a local incinerator, it's each individual personally burning the pads. So women and girls will collect the pads, during their period, and then at the end usually burn it in their backyard. And then finally, just in terms of, the cost of pads, what they're spending, it's approximately $1.5 per period, which adds up to nearly $200 over a 10-year period. And next slide. So in terms of the impact of the program, and this study is actually, it was done last year, so it doesn't cover the whole 60 villages, but in the first sort of 36 villages we worked in, we saw 90% adoption in our individual interviews and focus groups, which really suggests that nearly everyone in the community has switched to the Asan Cup. And when we say adoption, the questions we ask are not just around, are you using the cup, but also, are you still using cloth rags, or are you still using pads? And only around 10% are still using those alternatives. And then when we look at the impact of the program, I think, I'm not going to talk so much about cost savings and landfill, because that's something everyone here knows very well. And a lot of the presentations have already talked through. What I'd really like to focus on is the last two columns. One is on time saved, and because this is information that we really got through our focus groups, and what we learned was that it actually takes at least 2 hours per period to either scrub and wash the cloth rags, or collect and then burn pads. So that's a huge chunk of time that is actually being saved every period now that everyone is using the cup, which can be spent on other things. So it's a huge time saving, and that was one of the biggest reported benefits. And then another huge reported benefit, which I think, the previous presentation also really touched on, was days, we call it days of productive work gained. You can also call it, free movement, as Menstrual Cup Coalition does. But what we really learned was, on average, so it might be, 4 or 5 days for some people, it might be 1 day for some people, but on average, there's 2 more days every single period where you feel confident enough to leave your home to attend school or college, to daily wage laborers able to attend work. And that adds up to 260 days of, extra productivity, or just being free to do what you want over a 10-year period. Next slide. So something that I would really like to focus on in terms of the impact of menstrual cup programs is on mental health. I think this is something that was brought out very beautifully, actually, from the video we just saw in Kenya. But it's probably the biggest reported benefit that Asan finds, but the one that we struggle the most to quantify, because it comes out beautifully through videos and testimonials, but it's really hard to put into numbers. And if anyone has, advice on this, I would love to learn from you. But just to show 2 examples of impact on mental health. So Sonika is a college student at the rural college in Kanakapura. And when she compared, her experiences before and after using the Asan Cup, what she said to us was, because they don't have dustbins in college, she had to carry soiled pads home with her in her backpack. And it used to make her feel almost, nauseated and stressed and anxious. She'd be walking home with her friends, she'd be hanging out with boys, and she'd have these soiled pads with her. And just that freedom of, my gosh, I don't have to carry those soiled pads anymore, was such a huge, reduction of anxiety for her personally. And that was her biggest benefit in switching to the cup. Similarly, Nagama, who's actually one of our trainers and who previously used cloth rags, she shared that it would take her, so long each period to scrub the cloth and to, get the blood out, because she has quite heavy flow, and that her hands would start almost smelling while she was doing that. And the entire process of scrubbing the cloth rags made her not want to eat. So she would end up missing meals on her period just because she just was so sort of uncomfortable with the whole process of cleaning the cloth rags. And again, the biggest benefit for her was, you know what, I don't have to go through that process. I eat all my meals on time. I can go from village to village. So again, things that we find really hard to quantify, but immense benefits in mental well-being. Next slide, please. So just to end the presentation, I would love to share some of the learnings that Asan has had from this project, and what's worked and hasn't worked so well in terms of implementing a menstrual cup program. The first thing is, I would say, is it's so simple, but using a high quality cup is really important. Both in terms of, choosing a cup that, for example, won't leak, so people will continue to use it, but also durability, because very often, we are hoping this is a long-term intervention for 5 to 10 years. So you don't want to use a poor quality product, which will stop working well after 3 months. Secondly, cups should be offered for free. Now, again, this is something that Asan believes very strongly for 2 reasons. Firstly, from an ethical perspective, we believe that period products are a necessity and not a luxury. And that's why, for people who truly can't afford them, we always try to make them free. But I think there's a wider point in terms of menstrual cup programming, where so many resources go into education, training, behavioral change. And then if at the end of that process, you ask people to pay for a cup, you're only going to have, say, 10% of the group able to pay, and then you lose out on immense impact. So I also think from an impact perspective, it's really important for them to be free. Thirdly, trainers should be from within the community. I can't stress this enough, that all education has to come from a trusted source. The Beluku Trust, who we partner with, they live in these communities. They're from within the community, and because they've worked there on many different programs, their name is almost synonymous with, gosh, we trust what they're doing. And that's how we've had such high attendance of our interviews, follow-ups, and focus groups. It's because of the trust that this particular NGO enjoys. Fourth, cover the entire village or community area. Now, this is something that Asan has learned through experimentation, because we have had other programs. For example, we had a program with the entire women's police force in a city in India, where we just provided the cup to the women in the police force, but not to their extended networks, or not to their siblings, not to their mothers, and they all lived in different parts of the city. So we didn't have any network effects. When they took the cup home, the other people in their household didn't know what the product was, so they encouraged them to not try it. Whereas what we have here in Kanakapura is, because you cover the entire community, it links to point number 5 about the power of networks. There's just immense sharing from mother to daughter, from sisters, from your sister-in-law, and it really spreads from household to household. And so in terms of having that, 90% or whatever adoption rate, we really have found that providing the product to the entire community is going to have a much stronger impact. I'm just going to pause there. I just have the last slide. Just to say, we've just spoken about one program in South India, but Asan works across India and globally, and we're always expanding our partnerships. So please feel free to get in touch. And the best way to actually stay in touch with us and follow our work is on Instagram. So I'll drop our Instagram link in the chat. And thank you all for your time.
Amazing. Thank you so much. I also, the fact that in the last kind of hour, we've managed to do 5 different country contexts, but there's very, very clear lessons from each, which I think are so concrete, and they really feed some of the things that are coming up in the chat. I just want to I think one of the things for me out of Ira's presentation, which is really powerful, is when we're thinking about metrics and we're really talking about the fact that data is crucial, and we know that for the various reasons it's been highlighted, particularly by Jen, we need to also think about what reflects the values of the users themselves and the things that is helpful for them. And I think that speaks to Jen mentioned about participation rather than like attendance. So when I think of participation, one of the most powerful testimonies I've had is someone who was saying that they previously, a woman in her kind of early 40s was saying that up until starting to use the cup, she had never ridden a motorbike, a boda, which is the main form of transport here in Kenya, while she was on her period, because she was so worried about leaking. And now that she had the cup and she no longer worried about that, she could ride the motorbike, which meant that she could go to market and she could travel. Now, that's not a kind of attendance in terms of turning up at work, going to school, something that you're ticking off, but it is absolutely participation. And I think, as Ira was also saying, that, you know, whether it's called freedom of movement, whether it's linked to being able to travel or whatever, just thinking about, you're measuring the time and the freedom that people are getting back from how they previously were having to manage their periods, or the limits that it was putting on before. So I just think that's a really interesting framing of data, is, are we capturing something which is understandable, but is also really speaking to the lived realities of these organizations and individuals that we're working with? And I think also, I just wanted to highlight, I'm trying to filter through the chat a little bit. One of the things that has been coming up quite a lot has been questions around how you manage pushback, and particularly questions around for young girls. I think actually Ira has just in many ways answered it extremely well, with the kind of community and trying to address an entire community, not just picking individuals and then they go home and there's all the myths and misconceptions going on. I think particularly with young girls, it's really critical to ensure mothers, teachers, other people in the community are involved, ideally that anyone who wants one and is of the right age is receiving a cup, so that there can be a peer-to-peer understanding and support. But we can definitely also come on to that a little bit more. Just before I jump fully into Q&A, I wanted to quickly introduce Nasima Noor, who is a new PhD student at the Liverpool School, because in conjunction with the Menstrual Cup Coalition, Nasima is going to be collecting a bit more information, because I think in the kind of coming weeks, because one of the things I think is really clear for today is that there is so much going on. And a few years ago, it was easier to have a sense of what was going on because there was less people in the space. I think also with the combination of COVID and us not seeing each other so much, it's a great chance. And a clear example of this is when we emailed members asking who wanted to speak today, we got far more responses than we expected, and weren't able to profile everyone, and we'd love to be able to do more of that. So I'm just gonna, Nasima, pass over to you for a minute or two just to introduce yourself and tie that in, and then we'll jump to the Q&A more broadly. Thanks.
Thank you, Althea. Hi, everyone. My name is Nasima Noor. I'm a researcher at the Liverpool School of Tropical Medicine, where I'm doing my PhD on the effectiveness and sustainability of menstrual cups as a menstrual health solution in low and middle income countries. I've been working with the Menstrual Cup Coalition to design a survey to collect information from the growing number of menstrual cup programs in less developed countries. The aim of the survey is to try to understand the scope, scale, and results emerging from these programs. So, the survey will ask, not just the location of where menstrual cup distribution is taking place and the total number of cups distributed, but we'll also ask details like, how do you acquire the menstrual cup? Is it through donation? Or do you, get it at a discounted price from the manufacturer? Who are the target recipients? Adolescent girls, women, both? Is the menstrual cup just distributed as part of a campaign, or in addition to some training on how to use it, or is it part of a program that provides education on menstruation and sexual and reproductive health? And last, we'll ask questions around whether you monitor the use of the cup, do you follow up with recipients, and the frequency with which you do so. We'll ask if you could share data on that you've collected through your program, which we will of course keep secure, so that we can try to synthesize and see if there are any findings and learnings across menstrual cup programs. The survey is currently being finalized. We'll send it out by email in the coming weeks, so please look out for it, and please, of course, take it. I think it would be tremendously helpful to try to collect this information in a standardized way so we can better understand the needs, challenges, and successes of menstrual cup programs. Thank you. Over.
Great. Thank you so much, Nasima. And I think that kind of leads a little bit on to say, we are really trying to understand as the coalition kind of what's going on to be able to profile and support different organizations and signpost people here. So I really hope we'll be sending out a follow-up, and that'll include that survey. Really encourage you to share it with anyone else that's working in the space. To keep in touch with us, it's also really crucial that you become a member and join up. We'll put the details about that. There's just a couple of questions in the chat box that I want to, it's absolutely great to see people kind of chatting back and forth. And I think there's a few things that it'd be useful to perhaps profile more widely. I wanted to perhaps, Jen, is it all right to come to you to talk a little bit? You've done work around product choice. And I think it is, I totally appreciate a couple of people highlighting, you know, I'm obviously an extremely big cup fan, but they don't, you know, as we've seen today, they have a high uptake of about 80 or 90% usually, but we know that they don't work for everyone for a range of reasons. And I think it's really important that we're not excluding or penalizing people where they don't work. And trying to ensure that if you're doing a training or an introduction with menstrual cups, that even if you don't end up using them, you still can benefit from it. So balancing menstrual cup interventions without pushing cups on people, I guess, is a key thing. Jen, I feel like sorry to pick on you, but I feel like you've done a lot on this, so maybe you can give a quick speak to your experience.
Yeah, thanks. We have done a lot of this on this because from the beginning, we understood that cups don't work for everyone all the time. Most people, when you are able to use a variety of products during a period, maybe during one period, maybe over the course of your periods, you know, depending what you're doing, how you're feeling, you know, how your period might change. And so from the beginning, we were working with reusable products, but it was cups and washable pads. And the aim was to give people the information and let them make the choice. And we did it in terms of you choose one or the other, just because like we didn't have the resources to give everybody everything. But ideally, like what we're working on is making sure that these products are available for people depending what they want. And so, you know, you get the information, you can ideally make an informed decision around what would you prefer. A lot of times what we see is like washable pads are very familiar to people because you're either using disposable pads and you're definitely using like fabric and stuff. So that's an easy in, especially, you know, for people who are younger. And then what we often see is that either around a certain age, depending on the country, they're more willing to switch to cups, or like after the package of pads has run its course and they don't have access to another one, they're like, oh, I want a cup now. Also, usually they're 1 or 2 years older, they have, you know, colleagues or friends or family using cups. And so in an ideal world, people are learning about both, having access to both and able to make an informed decision about what they want, able to access them. Obviously, that's not the case. And so that's where organizations like us and a lot of the people highlighted here come in terms of providing these products as best as possible. But yeah, ideally, you're talking about both and giving people information on an informed decision because, yeah, cups don't work for everybody. And I'm one of those people who I love cups, but I also use other stuff during my period, depending how I'm feeling and what I'm doing. So, and I'm a very privileged menstruator. So yeah, I think that's my take on that.
Great, thank you. And I think it's also a really key, you know, it's not wanting to seem ever as though there's a guilt or a challenge around not liking cups or about it not working, and that is a really crucial part of the program. I think particularly when you're in contexts such as schools, whereas there can be a sense of like almost then a shame or stigma being added to girls if they're not using the cup because that's what's, you know, meant to be happening. So I think, you know, there's a lot there, and that actually really ties to some of the other key questions that are coming in around working with adolescent girls in particular. And I think you know, this is something that a lot of us in the space have been discussing for a long time around, there's quite clear research which suggests that menstrual products are, your habits around menstruation are really formed usually within the first year of you having your period. So whatever you are taught or shown to be used, usually by your mother or a friend or whatever, in that first year, it's a bit like which bank you go to. Once you've made that habit, you tend to stick with it, which means that it's a really crucial point to come in with education and highlight to other people different options. We also know that from the data around schooling, and as has been discussed, data around school dropout is so difficult to analyze in terms of what the direct causation is. There are so many things that can be a factor, particularly when you're in contexts where usually there's fees associated with schools. So it may just be that the parents aren't able to pay that term. There's a lot of other responsibilities that girls are perhaps being expected to do. There's a whole load of a swathe of other issues. Having said that, we also know that again and again and again, girls are mentioning that they don't go to school because of their period, or that they worry about leaking or whatever. So that introducing a sustainable and easy menstrual product for them to use early on is key for keeping them engaged. So I wanted to pass over to Dr. Garazi, I hope, because I know that a lot of their study had been around the kind of adolescent girls, and to just talk through some of those challenges when you're facing questions around virginity or insertion or a lot of myths and taboos. We've certainly, I think a lot of us have heard a lot of those questions, but Garazi, I'd be great to just hear any of your experiences on that.
Thanks. Yeah, and I'm sure given the chat, others have experience in this realm also. So when we were familiarizing the community and the parents and the teachers and the village chiefs to our study, this question came up quite a bit around like, oh, won't it encourage sex, or oh, doesn't it tear their hymen? And so we did a lot of work around, explaining what virginity is and isn't, and that, if a girl is playing sports and falls or kicks the ball really hard, she can tear her hymen also. And so really engaging that conversation, I think head on was one of the things, not shielding away from it, not trying to deflect, but really explaining, that a menstrual cup is a menstrual product. It's nothing to do with girl sexuality or sexual engagement, sexual debut. To know also, there's been questions around age and at what age are menstrual cups appropriate. Our study was enrolling girls in secondary school. So they were like slightly older than immediately post menarche, but our pilot study, which was in primary schools, also in CIA County in 2012, 2013, 14, saw very high rates of girls using cups at that stage as well. And we recommend engaging like peer champions who are age mates who do use the cups to encourage use amongst other girls, because for many of their parents and teachers, it's not a product that they themselves are familiar with, as you're stating. And so using other peers, using people kind of who look like them, seem like them. And yeah, just to note that for that cohort, the age was under 14 for most of them. And they also saw 80-90%, or the pilot study saw 80-90% over time, right? So cup uptake isn't immediate. Girls might not be super familiar with their body, especially at a young age. And so giving them the time and space to really become familiar with the cup is key. For some girls, it takes up to 6 cycles. That's like half a year of engagement. But it then pays off, because what we've seen in the trial is 1.5 years after use, we saw a huge spike to about 75%, and 2.5 years after use, it kept growing. We got to over 80%. And so some people have asked on the chat, like, did it taper off? Did people stop engaging with it once we backed out? No, once they became familiar with the product, they didn't require our continued promotion. So I might have diverged on the question, but
No, thank you so much. And I think that really speaks. We certainly, Ajrang, I think in her presentation touched on this briefly as well with schoolgirls, that I think a lot of people, yes, you may get more initial pushback, I guess, is a bit more of a questioning or whatever, but that doesn't, I would say that the crucial thing is that doesn't mean that it doesn't work. It just needs a little bit more follow-up, a little bit more support. I know that from that Kakamega program, after 3 months, only about 20% of the schoolgirls who were quite young, some of them were primary schools, so 13, 14, were using, but another 6 months later, it jumped up to kind of 75, 80. So it's that, it's ensuring, and I think that's the critical thing, is this is slow. You've got to keep the follow-up, and that those training, also that the female teachers in the school are all using the cup. They know when someone, like you saw in the video, that if someone comes to ask them questions, that's that holistic response. So thank you, Garazi, for that. I think I also just want to highlight that these things, there's another question in the chat about some of the pushback people get around running water, long drop toilets, a lot of these practical things. The Menstrual Cup Coalition, as much as possible, tries to collate. We have a frequently asked questions on the website, and that's the sort of thing that really just equipping anyone that's going into these conversations to be able to answer the fact that, I mean, crucially, one of the things that I feel very strongly about the toilet question is the fact that you generally have to change a cup way, way less than you do any other menstrual product. If there's an issue with toilets, that's an issue for any product. It is not worse. If anything, it's easier for a cup, because usually you can use a cup for 8 to 12 hours. So most people say, oh, it's great because I put it in the morning. It doesn't matter where I am all day, whether there's a long drop, whether there's whatever, because I can just deal with it again when I get back home. It takes significantly less running water than a reusable pad to wash out properly. When you're on your period, you can just empty it and put it straight back in. So you actually don't need the resources. I think, again, people understandably, because of misconceptions, get caught up in worries about what there might be, but in really resource scarce settings, they're again significantly more efficient. And when we talk about the life cycle analysis of cups and looking at their impact on the environment, that includes all of the upkeep. So compared to other products, the amount of water and things that needs to be used. But I think one of the challenges is a lot of these misconceptions, and that's really the goal of events like this and the Cup Coalition, is that I regularly am told, oh, well, I spoke to this one person and they didn't really like it, or, you know, and it's trying to get beyond those like one person anecdotal nervousness, which, as Ira highlighted, may actually just be because they didn't use a very high quality cup. Not all cups are the same. It's really important that you get a high quality brand. But also to go beyond that and look at what the evidence is saying. So all of these studies, which, and cumulatively across the people that have spoken today, that'll be thousands of cups, and uptake, if it's done right, is around 80 to 90%. So I think that's the thing, is trying to, when there's the pushback from NGOs or programs on this, how do you balance that? You try and use the evidence. That's what we're trying to do, at least as much as possible, is listen to the concerns and then really use the evidence. I wanted to just, there's a little bit that's coming up in the chat around the discussion around kind of risky sexual behaviors and the sort of sex for pads, which I know is something that has really grown in kind of attention and is sort of linked menstrual health to a whole other elements of increased rates of sexually transmitted disease, unwanted pregnancy, and also just highlighting the measures that people will go to get hold of menstrual products. Kofi, I don't know if you're able to come in and just, do you have any more information? You mentioned at the beginning of your presentation around a statistic of 83%, and have I got that right, of people that had been shown to be potentially trading either sex for pads or risky behaviors. Do you have a little bit more information around that data and how that linked to you deciding to try a menstrual cup intervention? Because that seems very relevant.
Yeah, so this study was funded by Plan International. So we followed up the results and we got in contact with the researchers. And then we went in with the menstrual cup intervention. Indeed, when we went in, we were surprised because it's real. It's not something that has been cooked. It is not something that people sat somewhere to generate story. It was real that people were really transacting that. And we had some engagements with those who were affected. And then we went in with a menstrual cup intervention. And I would say that throughout that period that we engaged them, we have seen some significant changes. In as much as we have not done a research again on the transactional sex, but we have seen that we have met their needs. Because of that, they were chasing guys and so many people to meet their menstrual needs. So the menstrual cup intervention has really met their needs, and we are yet to do another research on the sex on that transaction. And we have seen some significant improvement in their access to hygienic products. In fact, I wish I could share some more data on what we have done and the outcomes and also what has really happened. But I think maybe I will share. But we are working to publish that report. So when it comes, I'll be happy to share that with you. So yes, it's happening, and the menstrual cup has really been a tool to mitigate that poverty issue that were happening in Wa East. I'll be happy to share all the results with you. Yeah.
Great. Thank you so much, Kofi. And I think that really links us, very struck by the conversation around, you know, like the mental health aspects of menstrual health and feeling empowered and feeling safe. And, you know, so there's so many elements here that I think these things link in, you know, and feeling that you're able to, you know, as I think someone said in their presentation, that you have a product every month and you don't have to think about it. I'm really aware of time, and I don't want to take too much more. I'm also, you've no idea how having this many people, what are we at, about 50, having stayed on for an hour and a half around menstrual cups is a real dream come true from my perspective. I did want to, there was just, oh, I've now lost it. There was a question around, there was two things. There was one around adolescent girl, sorry, the difference between adolescent girls and communities, sorry, sort of schoolgirls and older women. And Ajwang, I wanted to just maybe quickly say, because if you wanted to come in to just highlight again, I think there was a question around kind of the fact that there's a lot of focus on adolescent girls, but adult women, I mean, I always am very aware of saying, you don't stop having your period when you leave school, and it doesn't stop being a barrier. And so just speaking to some of the kind of community engagement with some of those older women, and how the uptake, Ajwang, could you just speak again very quickly to the kind of uptake we saw amongst community, but then the challenges of tracking that? Because I do think most programs, not all clearly, but a lot of it has just been schoolgirl focused. And so a little bit of just another minute or perhaps on that kind of the community group and the sort of people we were targeting them and what they'd been using before and how it changed things is maybe useful to highlight.
Okay, yeah. So we found that with the women, a lot of them, again, because the girls were receiving pads from school, so they still had some sort of sanitary product to use, whereas now the women, because they're fending for themselves, then they'd have to use, we had a lot of people using cutting mattresses and using that, a lot of women using rags, and even had one case of a woman who'd actually tried to use pads, but she didn't know how to. So just mostly between using rags and the mattresses. And in terms of follow-up, again, just based on this community in Kakamega, and going back to the initial distributions, the follow-ups are not able to take place fully because of this new SIM card registration that happened late last year. So most of the women who had been distributed and had actually done their first follow-up, coming up into the second and third follow-ups, there was no way of tracing them. So the trainers really struggled with this. And just moving into even for other women that have had the distributions this year, all around the follow-ups, even when we've been present, just women going to their farms, or they've agreed on a time with the trainers, we're going to meet tomorrow at this time, we go there, people have gone to the farms, or we have to struggle and wait for almost a few hours just for them to gather. So we found that now the easiest way would be to use phone calls as a sort of follow-up method.
Thanks. And I think that, you know, highlighting what people are using before, and that actually when you're thinking about the need, there is this big focus around school dropout. But in some places, girls are being given something in school. And so actually often it's, you know, how do we reach out of school girls? That's a really crucial overlooked group. And that actually women who often are then also saving, a lot of the women were saying that if they do have money, they buy products for their daughters as well. So, you know, it's trying to sort of think, who do you equip? And also we know that definitely once you equip some of the community women, they then want to give them to their daughters and stuff once they've got used to them. And I think what's really interesting, just to flag on the follow-up issue that was mentioned there, is while it was harder to track them, we saw a huge uptake in the first follow-up, whereas schoolgirls, it took long, you had to do follow-up trainings more. Often I think women, particularly if they've had babies and are kind of a bit more comfortable and easy with their bodies, will start using the cup extremely quickly. It's just they then get on with their lives and it's difficult to be able to keep in touch with them, which is fair enough. Okay, I'm extremely aware of time. thank you so much. Honestly, we really don't take it for granted. It's really humbling and heartening to have so many of you online. Thank you to all of the speakers. I'm obviously biased, but I thought they were brilliant. And it's great to get a range of different things. We would love, I know Nasima's mentioned she's going to be doing this survey. We're really trying to get a better sense of who is doing what where. I don't think there's any central audit. And I think it really is powerful to be able to say, there are X number of CUP programs across the world. They've had these kind of results. You know, this is what's happening. So thank you for being here, for listening. If you have any questions, please contact us. I'm hoping someone's about to pop in the box. If you want to stay in touch with the coalition and be on our mailing list and stuff like that, please contact. And there we go. Yeah, Mara's just posted it in the box, cupcoalition.org, get in touch. It's great to hear about your work. Otherwise, have an amazing rest of your Wednesday. Thank you very much to all the rest of the speakers, morning, evening, afternoon, wherever you are. And we look forward to being in touch with you soon. Thank you so much.